Hello guys, welcome and welcome to Metier Academy, one of the leading academy in training nurses in the nursing competitive exam as well as IELTS, NCLEX and OET training. And today, welcome back to Magic Pill session. The topic what we are going to discuss today is from psychiatry nursing, that is somatoform disorder. So many times, repeatedly, the questions are asked from this particular topic. So we are going to discuss the previous year questions so far asked in the exam in detail, and also we are going to discuss the golden point which is related to that particular question. So watch the video till the end. Definitely it will be so much useful for you. And if you like the video, please like it, share it and subscribe the channel guys. So most of the candidates are watching the video without subscribing the channel. Please subscribe the channel so that it will motivate us to post more and more videos. Okay. So let's begin the session without wasting the time. Let's begin the session with a motivational thought. The thought of the day is the best way to predict your future is to create it. See, you have to create your future. Don't wait. The future will come on its own. You have to make the future. You have to create your future. No one else is going to bring you a bright future for you. You have to make your bright future. Okay. This quote is said by the Abraham Lincoln. So with this motivational quotes, let's begin the session. As I mentioned already, the topic what we are going to discuss is somatoform disorder. It is very interesting topic. See, first you should know what is meant by somatoform disorder. Okay. So here in SD, that is somatoform disorder, actually it is a psychological condition, but here the patient is experiencing the physical symptoms without any underlying medical condition. Okay, the key point what you supposed to note here is three key points are there. Actually, it is a psychological problem. That is the first important point. But here the patient is experiencing the bodily symptoms, otherwise physical symptoms. Okay, so that is the second point. And third point, without any medical condition. The patient doesn't have any medical condition, but still he is experiencing what? Bodily symptoms. Okay, so this is called as what? Somatoform disorder. So three key points I have mentioned here. Somatoform disorder means physiological condition, but still they are experiencing bodily symptoms without any medical condition. These 3 points you're supposed to remember. Okay, so let's see the classification of this somatoform disorder. Actually, two broad classification is there. It is based upon the symptoms. Okay, the patient is experiencing some bodily symptoms. Okay, so based upon the experiencing symptoms, I have classified this into two types, that is involuntary and voluntary. First, you should understand the concept of what is involuntary and voluntary. Involuntary in the sense without the control of the patient. Without the control of the patient, they are experiencing some kind of symptoms. Okay, they are not purposefully showing the symptoms. Without their control, some symptoms is going on in his body. Okay, that is called as what? Involuntary. Voluntary means they are purposefully doing some or showing some symptoms. That is called as what? Voluntary. Okay, simple difference. Without their control, without patient control, some symptoms are coming means that is called as what? Involuntary. And voluntary in the sense they are purposefully, wantedly exhibiting the symptoms. Okay, fine. So here, which is very important, that involuntary topic, what I mentioned, right? So that is very, very important. Okay, so this involuntary is further classified into three types. The first one is physical symptoms, second one is neurological symptom, and third one is preoccupation with symptoms. Okay, let's see one by one. After that, we can go to the question and answer session. The first one is physical symptoms. See, the topic what we are discussing is somatoform disorder. Under that, this classification I am explaining to you. Okay, so here the first involuntary classification is physical symptoms. See, physical symptoms means the patient is experiencing the physical symptoms, bodily symptoms. Okay, so without any medical condition, the patient is experiencing the physical symptoms. Okay, so this particular condition is called as what? Somatic symptom disorder. Okay, without any medical condition, underlying medical condition, there are some symptoms which is expressing in the body, that is called as what? Somatic symptom disorder. The first point is over. Second point, neurological symptoms. Okay, see, it is also called as functional neurological disorder. Functional neurological disorder. So what is this? It is also called as conversion disorder, guys. Okay, for conversion disorder is a very familiar term. You would have been heard about that. Conversion disorder, it is also called as functional neurological disorder. We are going to discuss each and everything in detail along with the questions, so no need to worry about that. But still, let me give you a brief introduction about the conversion disorder. See, conversion disorder, here the patient is going to experience the functional neurological symptoms. In short, neurological symptoms. Let me give some example like hallucination, problem with the senses, seizure, problem with the, yes, as I mentioned already, senses. Okay, so this type of neurological problems the patient will be experiencing. Okay, without any underlying medical condition. See, always please underline the word without any underlying medical condition. Okay, so that is very, very important in the somatoform disorder. Okay, so that is called as what? Neurological symptom. The last one is preoccupation with the symptoms. Here, actually, the patient doesn't have any physical symptoms, but they will be thinking that they will be having the preoccupied thought that in future, if they develop some symptoms, if they develop some disease, means what will happen? It is like an anxiety disorder, right? So this is called as this preoccupation with symptom. This is actually called as illness anxiety disorder. So three disorder we have discussed now. That is somatic symptom disorder, that is without any medical condition, physical symptoms are expressed by the patient. The second one is functional neurological disorder. It is also called as conversion disorder. Here, neurological problems like seizure, hallucination, problem with the senses will be there. And the third one is illness anxiety disorder. Here, the preoccupation of thought with the future problems, future symptoms, future diseases. They will be thinking about in future, if I get this disease, what will happen to me? Okay, so these kind of thoughts will be there for the patient. So these are all the three things which is coming under what? Involuntary. And the next one is voluntary. Actually, it is not that much important, but still, the first one is very, very important. That is factious disorder is very, very important. So already 2 or 3 times they have asked questions from this factious disorder. So let me explain about that also. So now we are going to discuss about what voluntary. It is further classified into two, that is want a sick role and want secondary gain. Actually, voluntary means already have given the explanation. Here, the person purposefully, they are showing the symptoms. The patient purposefully showing the symptoms. Actually, they doesn't have any problem at all, but still they are purposefully exhibiting the symptoms. That is coming under what? Voluntary. So, if they want to uh, make some person, empathy toward that particular patient, then they will be playing some sick role. Okay, they are playing some sick role. Okay, so that time it is called as what? Factious disorder. That time it is called as what? Factious disorder. Okay, and the second one is want some secondary gain. Okay, for example, if they would have been insured in order to get some insurance money, they are acting like they are having some disorder. Okay, that is called as what? Malingering. That is called as what? Malingering. Okay, so on the whole, these two things are the patient purposefully exhibiting, purposefully showing without any actual disease. Purposefully they are showing or exhibiting or pretending like they are having the disease. Okay, so this is the difference between involuntary and voluntary, guys. Okay, first question what we are going to discuss is the laboratory indifference is related to. It is a direct question, and this question recently asked in AIIMS and JSSHS Delhi exams. Four options they have given here, that is conversion disorder, OCD, anxiety disorder, phobic disorder. Among these four options, laboratory indifference is seen in which disorder? So here the right answer is going to be option A, that is conversion disorder. So in conversion disorder, we will be seeing the laboratory indifference. So what is laboratory indifference? What is conversion disorder? These two important points, meaning you all supposed to know. Okay, so first let's discuss about the laboratory indifference. See here, the laboratory indifference, here the patient appears almost calm and never bother about the medical condition what they are suffering from. This is called as what? Laboratory indifference. Once again I will repeat, please listen carefully. Even though the patient is suffering from serious illness, they doesn't bother about the illness. The patient always remain normal and calm. That is called as what? Laboratory indifference. And this laboratory indifference is seen in conversion disorder. Okay, let me explain or give some examples of laboratory indifference. You can see very clearly here. The last point, the patient with paralysis of the legs or arms seem totally unconcerned. Means the patient, even though having paralysis of the legs or in the arms, they doesn't bother about the disease what they are suffering from. So this is called as what? Laboratory indifference. This is the first vital point. Second vital point, it is seen in conversion disorder. Okay, the third vital point, what is the other name of laboratory indifference? In exams, either they can ask with the key point laboratory indifference. If the key point laboratory indifference is not there, you have to search for beautiful indifference. If these two key points are present, means you have to think about what? Patient appear calm and doesn't bother about the disease condition what they are suffering from. And one more thing, this laboratory indifference, it is connected to the conversion disorder. These are all the points supposed to come into your mind while solving this kind of questions. Okay, fine. The next one is, so you all know about what is labially indifference. Now we are going to discuss about what conversion disorder. See, as I mentioned in the introduction itself, what is meant by conversion disorder? It is also called as functional neurological disorder. Here, the patient will be experiencing the neurological symptoms, underline the word neurological problems, without any underlying medical condition. Without any underlying medical condition, the patient is experiencing the neurological problems. Example, like, seizure, hallucination, problem with the senses, tremors, difficulty in walking. These are all some of the problems of the conversion disorder. So once again, I will repeat, conversion disorder, it is a neurological problems without any medical conditions. Okay, I have given the examples also. Let me discuss one question which is related to the conversion disorder so that it will be easy for you to understand the link between the conversion disorder and labially indifference. Okay. Here in this question, you can see very clearly it is a scenario question. A client with the conversion disorder states that she is unable to move her legs. Okay, so the client who is suffering from conversion disorder, she is saying that she is unable to move her legs. The nurse would expect a person with this problem too. So as a nurse, what you have to expect from the person? They are asking the reaction from the patient. Okay, so 4 options they have given here: appear greatly depressed because of the problem. The patient appears greatly depressed. Second option is the patient is almost calm and composed. Okay, so now you have to think about labially indifference. Okay, calm and composed, doesn't bother about the medical condition. So you have to relate that one with this one. Okay, the next one is exhibit free floating anxiety. Fourth one is demonstrate anxiety while discussing symptoms. 4 options. So conversion disorder means you have to correlate with labially indifference. So if you are thinking about labially indifference, immediately you have to think about what? Patient is calm and doesn't bother about the disease condition what they are suffering from. So if you think like that, then you will go to the answer B. Yes or no? Yes. So here also the right answer is what? Option B. The patient is going to appear calm and composed. Okay, guys. So this is how you have to correlate the questions. Okay, the next question what we are going to discuss is an individual cannot remember event during the time immediately following a serious airplane crash due to which of these? Okay, understand the question. This question is asked in LNJP Delhi. It is a pure central government hospital. So here the scenario is the patient cannot remember the past event after the stressful situation. For example, here what is the stressful situation happened? There is a plane crash. That is a plane crash. So the patient forgot everything, whatever happened in the past after the plane crash. After the plane crash, the patient forgot everything happened in the past. A retrograde amnesia happened after the plane crash. Okay, so which condition is related to this scenario? This is the question. So 4 options they have given here: dissociative fugue, dissociative amnesia, retrograde amnesia, fractured amnesia. 4 options they are given here. Let's discuss the answer. Here the right answer is going to be dissociative amnesia. After the stressful event, they are forgetting the past. The past memories, that is retrograde amnesia, happens after the stressful event. Okay, so this is called as what? Dissociative amnesia. Here it is very clearly I have mentioned in the rationale. Dissociative amnesia, it is also called as psychogenic amnesia. It is very common type of amnesia, and the characteristics of this amnesia is here the patient inability to recall the important personal information. That is retrograde amnesia will happen after a stressful event. Okay, this is the key point. Retrograde amnesia after the stressful event. Okay, so if this kind of scenario based questions are coming, means immediately you have to think about what? Dissociative amnesia. Okay, let's discuss about all other options in another questions. Okay, for example, dissociative fugue. Means in next question we are going to discuss about dissociative fugue. Okay, so this is how we are going to link each and every questions and options, guys. Okay, so while you are studying one question, you are going to study 4 options in detail with the rationale. So this is how you have to prepare for the exam. Actually, you are studying one question, but each and every question it is having 4 options. So whatever the option they have given there, you have to study the rationale of each and every option so that it will be easy for you to solve the questions in the exams. Okay. The next question what we are going to discuss is the person has run away from home, adopting a new identity with complete amnesia about his earlier life. This disorder is called as what? This question is repeatedly asked question, recently asked in AIIMS Bhopal SNO examination. Okay. So here the key point is the person completely lost his earlier life, means memories, that is amnesia about his earlier life, and he is adapting a new identity. Okay, so these are all the 2 points you're supposed to remember. Okay, adapting new identity and forgetting the past life. Okay, so these 2 points are there, means immediately you have to think about what? Dissociative fugue. Dissociative fugue. Okay, so already the meaning of dissociative fugue is already given in the question. You can see here a dissociative disorder characterized by the loss of identity, and here the patient, after losing the identity, he will travel in different direction. Okay, and he will start a new life with a new identity. Okay, he will start a new life with a new identity. Okay, so this is called as what? Dissociative fugue. Okay, the next question what we are going to discuss is this question asked in NVS, Navodaya Staff Nurse exam, and also LNJP. Preoccupation with fear of having a serious physical illness not based on real or organic pathology. Here the key point is the patient is preoccupied with the fear of having serious physical illness. Actually, the patient doesn't have any illness, but still they are having the preoccupied ideas that the patient is having what? Some serious physical illness. This kind of thoughts is already preoccupiedly present in the patient mind. Okay, actually there is no problem, but still they are having this kind of problems. Okay, so this question, as I mentioned already, asked 2 times recently in the exams. 4 options they have given here: hypoesthesia, hypochondrosis, hypertonicity, and psychosomatic disorder. These are all the 4 options they have given here. Here the key point what you're supposed to note is patient is having the preoccupied ideas of fear about the illness. Actually, the patient is not at all suffering from the particular illness, but still the patient is having the fear of having some serious illness. Okay, so let's see the answer here. Here the right answer is what? Option B, hypochondriasis. So what is hypochondriasis? It is also called as illness anxiety disorder, guys. This illness anxiety disorder also we have seen in the introduction. Illness anxiety disorder, it is previously called as hypochondriasis. It is a psychotic disorder. Here a patient excessively worry about having or developing a serious undiagnosed medical condition. Okay, they are always worrying about what? They are suffering from serious medical condition. Actually, there is no problem for the patient, but still they are worrying about the medical conditions. Okay, the next one is hypoesthesia. Hypoesthesia, it is one of the options here. It is a medical term for a partial or total loss of sensation in a part of the body. That is called as what? Hypoesthesia. Okay, it is not at all related to this question. The next one is a psychosomatic disorder. What is psychosomatic disorder? Here, the patient is developing a stress or emotion. Because of the stress and emotion, the patient is developing a physical illness. Okay, because of severe stress, the patient is undergoing some medical problem, that is physical problem is arising. Because of psychological problem, the patient is getting some physical problems. Okay, so this is called as what? Psychosomatic disorder. Okay, so on the whole, we have discussed 3 main things in this question, that is illness anxiety disorder, that is previously called as hypochondriasis. The second one is hypoesthesia, and third one is psychosomatic disorder. Okay, fine, guys, let's complete this session. Till now, we have discussed few important questions, which is very important and repeatedly asked in the previous year question paper, which is related to somatoform disorder. And if you like the video, please like it, share it, and subscribe the channel. Most of the students, as I mentioned already, watching the video without subscribing the channel. Please subscribe the channel so that it will motivate us to post more and more videos, guys. Thank you very much for watching the video.